Assalamu alaikum. My name is Bibi Zainab and I'm the student of 4th year morning. My roll number is BP16500053 and I'm from group number 54. The topic which is assigned to our group is eye disorder and I choose acute bacterial conjunctivitis for my presentation. Before going to the acute bacterial conjunctivitis, first of all, we discuss about the conjunctivitis. Basically, conjunctivitis is an inflammation of the transparent membrane of the eye, which is known as conjunctiva, that lines the eyelid and covers the white part of the eyeball, and small blood vessels in the conjunctiva become inflamed, then they are more visible. This is what causes the white part of the eye to appear reddish. Conjunctivitis is also known as pink eye. It is commonly caused by bacterial and viral infection. Acute bacterial conjunctivitis is an infection of the eye in which one or both eyes become red with associated discomfort. The condition is not normally serious. In most cases, it clears up without treatment. After discussing about acute bacterial conjunctivitis, we discussed that which type of bacteria cause the infection. The Staphylococcus aureus, Streptococcus pneumonia, and some species of Haemophilus are responsible to cause this infection. Symptoms. The most common symptoms of these infections include redness, itchiness of the eye, a gritty feeling, a discharge in one or both eyes that forms a crease during the night that may prevent the eyes from opening in the morning. It also increases the secretion of tears. Treatment. In most cases of the infection clears up without any treatment, but if it becomes severe, then we need to treat it with different medications and precautions. If the infection is uncomplicated, then we use topical antibiotics like tubramycin and polymycin B. In case of serious damage and infection, we use irrigation of conjunctival sac. If the infection is severe, then must wear dark goggles. No steroid and bandages should be applied. We can also give anti-inflammatory and analgesic drugs in case of pain and inflammation. Now come to our main topic, the case study. The patient is male. He is 34 years old. The patient wears contact lenses due to having myopia. However, there is no known history of him having any disease connected to eyesight problems. The main complaint of the patient include redness and itchiness of the conjunctiva of the right eye, increased tear production, and presence of liquid discharge in the eye. Moreover, he reports to having problems with wearing his contact lenses. The right eye started to itch and burn 3 days ago. The patient tried to clean the eye with water and searched for any foreign object that might have caused the irritation. Then the patient applied Visine eye drops, which temporarily soothed the irritation. However, the redness is not go away. The left eye seems to look healthy. The patient reports to having good hygiene and says that he washes hands regularly. Dealing with case study according to the SOP note. SOP stands for Subject, Object, Assessment and Plan. We discuss all the headings step by step. First of all, we discuss subject. In subject, we cover chief complaint and history of the patient. Chief complaint. The main complaint of the patient include redness and itchiness of the conjunctiva of the right eye, increased tear production, and presence of liquid discharge in the eye. History. The patient had no any previous history related to the eye disease. The patient is male and their age is 34 years old. The onset of infection is 3 days ago. The location of infection is right eye. Object. The duration of symptoms is 3 days ago. The vital signs, height and weight of patient is the height of patient is 5 foot 8 inch. The weight is 150 pounds. Temperature is 98.5 Fahrenheit. Pulse rate is 74 and the blood pressure is 117 by 73. Assessment. In assessment, we discuss all those infections which can occur according to the science. It can occur due to a number of reasons include allergic reactions, bacteria, respiratory infections, and bad hygiene. All types of conjunctivitis are characterized by redness and itchiness of the eye, excessive tear production and discharge. However, some symptoms are different. Allergic conjunctivitis occurs seasonally and followed by other types of allergic reactions such as hay fever and asthma. Bacterial conjunctivitis can occur together with other infections. Furthermore, improper hand washing can cause conjunctivitis as well as contact lenses may also irritate the eye if they are not stored and handled properly. Medical diagnosis. The discharge of patient's eye is not thick, which rules out bacterial conjunctivitis. The patient denies having any infections or allergic reactions. However, he admits to wear contact lenses. Therefore, it is safe to believe that the irritation of the right eye is caused by improper lens care. It is possible that the patient failed to clean the contact lenses correctly, but due to bad hygiene, patient also have mild bacterial infection, which result in the infection and redness of the right eye. The diagnosis of the bacterial conjunctivitis with normal infection is confirmed. Now come to the plan. Most types of bacterial conjunctivitis and other infections are not require additional treatment. However, to soothe the irritation, the patient should continue to use Visine eye drops and adhere to a structured hand wash routine. The patient should change contact lenses and consider purchasing different brand of lens solution. Follow-up plans. If the patient continues to experience irritation in his right eye, in this case, the next meeting should include additional tests and follow-up instructions. If the problem does not go away, the patient can take topical antibiotics such as tuberamycin to stop the inflammation and in case of pain, patient can take diclomycin and diclomin analgesic to reduce the pain. This is all about the acute bacterial conjunctivitis, their symptoms and their treatments. Thank you.